Let me ask you a question. Have you ever tried to lose weight and thought, if I could just stop eating so damn much, I'd be fine? Or maybe you were told, just eat less, move more. It takes willpower. Or more recently, your provider just handed you a prescription for Ozempic and said, congrats, you're fixed. Go forth and be skinny. If any of that sounds familiar, this episode is for you. Because today, we're going to blow up the myths around weight loss and metabolic health and explain why so many people are stuck, frustrated, and regaining weight even after doing everything right. This is the first deep dive into my Take It Back method, and we're starting with a pillar I'm most known for, weight loss. So let's start with the hard truth. Most healthcare providers are really, really bad at weight loss. And I say that as someone who was one of those providers. When you look at how they've been trained over the last 40 years, we gave them two options for dealing with patients who wanted to lose weight. Originally, it was just about willpower. Try Weight Watchers, blah, blah, blah. Work harder. More recently, here's the shot. It's called semaglutide. Let me know how much you lose. That's it. Those are the strategies. One blamed you, the other blamed your pancreas and hoped for the best. I knew we could do better for my patients. So I got certified with the Obesity Medicine Association, where we actually study obesity like the complex chronic disease that it is, not a moral failure. In fact, I'm on the outreach committee for them, and it's my mission to bring understanding of this to more people. Through that work and years of experience, I've developed my own system. Let's talk about why Camp 1 and Camp 2 don't work. First up, willpower. If losing weight were just about willpower, we'd be walking around shredded all the time. But here's the reality. We theorize that your body has a biological weight set point. It's like a thermostat in your brain. And when you lose weight through restriction, your brain panics. It slows your metabolism, increases your hunger hormones, and tries to return you to that set point. That is not weakness. This is biology trying to keep us alive, even if that survival mode is now working against you in a world full of drive-thrus and desk jobs. Now, let's look at Camp 2, GLP-1s. Look, I use them in my clinic all the time. I think they're very powerful tools, but they are just that, tools, not a cure, not a magic shot, not a metabolic reset. Because what happens if you stop the medicine? Your brain remembers your set point and pulls you right back to where you started. We see it all the time in our clinic. So here's what I've learned after thousands of visits and years of data. Most people can't white knuckle their way to long-term weight loss. And you can't medicate your way there permanently either unless you stay on the medicine. You need a system that addresses insulin resistance, muscle loss, hormone imbalance, gut health, sleep, even your mindset. You need a plan that's based on real science, and real follow-ups and real personalization. And that's what we're diving into today. So whether you're struggling to lose weight for the first time or you've lost it and gained it back more times than you can count, stick with us because we're going to unpack exactly how we help our patients lose weight and take it back for good. Let's get into it. Inside the Take It Back method, we base our weight loss strategy on 4 foundational pillars. They're loosely adopted from the Obesity Medicine Association. These are my 4 pillars for medical weight loss: underlying conditions, nutrition, exercise, and medications. Let's walk through each of these. Pillar 1, treating underlying conditions. This is really important, and that's why we start with this. Because listen, trying to lose weight while you have a major hormonal imbalance, for instance, or thyroid dysfunction, or raging insulin resistance is like trying to run a marathon uphill in flip-flops, dragging a refrigerator. It just doesn't work. And I've seen it over and over again. People doing everything right, eating well, exercising, trying their hardest, and getting nowhere. Why? Because their underlying biology is working against them. Until we address what's under the hood, the medical issues that shift your set point up and make weight loss feel impossible, all we're doing is setting you up for frustration. Some of the most common underlying conditions we find in our clinic include things like metabolic syndrome and PCOS. These are often insulin-driven, and it's difficult to burn fat efficiently if your insulin is always elevated. Insulin is your body's fat storage hormone. If it's always high, your fat burning switch is basically turned off, no matter how hard you try. Insulin resistance and prediabetes, these are sneaky killers of progress. Simple labs might look normal to most providers, but we dig deeper. And because when insulin is chronically high, your body is just stuck in storage mode. Hypothyroidism and Hashimoto's disease, when your thyroid is sluggish, everything is sluggish. Your metabolism, your energy, even your mood. And Hashimoto's, which is an autoimmune disease, is wildly underdiagnosed, especially in women. Perimenopause, menopause, andropause, these hormonal shifts change your metabolism, make you gain fat, make it difficult to lose weight. We'll cover each of these and more in full episodes, but the takeaway is simple. If you don't treat what's driving your weight gain, the weight won't go anywhere. This is why so many people fail on traditional programs. They're handed a food log when what they really need is a diagnosis. Pillar 2, learn new nutrition. Let's talk about food. This is the part where most diets lose people, literally and figuratively, because the nutrition plans out there, they're either overly complicated, counting macros, tracking carbs, weighing your salmon, or they're so extreme no one can actually stick to them. Here's your raw kale and air for dinner. We've tried it all: keto, South Beach vegan, Mediterranean, carnivore. We've sent patients to nutritionists, diabetic educators, had them read books and watch documentaries. And guess what? Some of it worked, but almost none of it lasted. And the reason goes back to what we talked about earlier, the set point theory. If you struggle to maintain the nutrition consistently over time, or you can't continue the medication slowly, quietly, relentlessly, you will go back to your old habits and your body will return to its weight set point. We stopped chasing fads and we started asking what actually works long-term for real people with real jobs and real lives. That's when Jill, my wife, and I got to work at home, in our kitchen, with our patients, and eventually, after a lot of trial and error and debate over what's for dinner, we created something different: the Debban Diet. It's the plan that Jill and I live by, that our patients start with, and that we've fine-tuned through years of real-world trial and error. The Debban Diet is not a fad. It's not a cleanse. It's designed for lifelong use. And it was born the old-fashioned way, through blood, sweat, and clinic hours. Over 2 years, we worked side by side with weight loss patients, listening, tweaking, and figuring out what was actually sustainable. Not just what looked good on paper or in research journals, but what people could really do long term. And we didn't stop at our patients. Jill and I brought the diet home. We tested it. We lived it. We argued over it. And then we tweaked it again, until what we had was a plan that was so simple, so livable, and so effective that we built it into the foundation of everything we do. There are 3 core strategies we pull from: time-restricted eating, calorie restriction, and dietary restriction. The best part, you don't have to throw out everything in your pantry. You don't need special prepackaged meals, and you don't have to give up the foods that you grew up with. Because the number 1 rule of nutrition: if it's not sustainable, it is not going to work. So here's how the Debban Diet actually works in practice. You're not eating 3 meals a day anymore. You're eating 2. 2 meals a day. Of those 2 meals, one should be small. For women, about 250 to 300 calories. For men, about 300 to 500 calories. The other meal, a normal supper, real food, enjoyed with your family, or however you like to wind down the day. That is literally it. We stop eating by 8 p.m., no late night snacking, give your body a break, let the insulin levels come down, let the fat burning switch on. Occasionally, people get tripped up with this. When you cut down to 2 meals a day, it gets harder to hit your protein goals. So over time, we've learned that protein is critical for maintaining muscle, metabolism, and feeling full. So we emphasize protein at those 2 meals. 2 meals a day, one of them small, no sugary drinks, stop eating by 8 p.m. It is literally that simple. The structure makes it easy to stick to long term. And when people hit a plateau, we don't panic. We track calories for a bit. We tweak the meal timing or their portions, and we keep going. Because it's not a crash diet. It's the foundation of a lifelong plan. There are a few other minor things that we incorporate into it, but the bottom line is this. The Debban diet isn't trendy, but it works. It doesn't promise overnight transformation. It builds lifelong change. We've tested it in our clinic. We've tested it at home. And more importantly, it's been tested in the real lives of hundreds of patients who just wanted to feel good again. If you're tired of complicated plans, tired of starving, tired of fads, try something built on real results, real patients, and real life. The Debban diet is where we start with each of our patients. All right, let's talk about the next pillar in our metabolic reset and our medical weight loss, one that gets a lot of attention but is often misunderstood: exercise. Now, here's the truth. Exercise is not the best tool for losing weight, but is absolutely essential for keeping it off and for improving nearly every aspect of your physical and mental health. And when it comes to exercise, our philosophy is simple. Muscle is medicine. In fact, if I could prescribe it in a bottle, I would. Strength training boosts metabolism, improves insulin sensitivity, protects your bones, improves your moods, increases energy, and makes weight maintenance dramatically easier over time. But, and this is important, we don't expect you to become a gym rat overnight. We're not looking into overly complicated routines. We're going to dive deeper into all of this in an upcoming episode very soon with a special guest expert, and we'll break this all down. What to do, how often, how hard, and how to make it sustainable. So if you've ever felt overwhelmed, confused, or frustrated by exercise advice, or you just need a clear plan, you're going to love what's coming. Stay tuned. You're not going to want to miss that. And that brings us to the final pillar of our medical weight loss plan, and one that gets a lot of attention lately: medications. We'll be doing future episodes that take a deep dive into each medication option, how they work, who they're best for. But today, I want to give you a quick overview of how we approach medications in our clinic and why they're a key part of the Take It Back method. Here's the most important thing to know. We don't use medications to replace nutrition. We use them to support it. If a medication can help you feel just a little less hungry, if it can help with cravings, if it gives you breathing room to focus on consistency and mindset, then it's a tool worth considering, but it's never the whole toolbox. We follow the OMA's guidelines, and we primarily work with 3 medication classes that are well studied, well tolerated, and most importantly, they work for us. Let's walk through them real quick. First of all, we have Contrave. This is a great option for people who struggle with emotional eating. It's also one of the best tolerated options and can help with mood, motivation, and energy as well. Qsymia is next. We use it often, and it can be incredibly powerful when paired with our Debban diet. Finally, we have GLP-1s, Wegovy, Zepbound, Saxenda, the injectable medications. These are the newest and trendiest kids on the block, and for good reason. They can be life-changing for the right patient, especially those with insulin resistance, prediabetes, or a metabolic syndrome. But here's the catch with them. They're expensive and often hard to get. So we look at GLP-1s through a real-world lens. Does it fit your biology? Does it fit your lifestyle? And most importantly, does it fit your budget? We're not here to sell you a shot. We're here to build a plan that works for you. So whether it's Contrave or Qsymia, a GLP-1, or something else, medications in our clinic are always used with intention. We don't prescribe and pray. We coach, we monitor, we adjust, and we always pair medication with strong nutritional habits. Medications make you less hungry. If you are less hungry, you can stick to the nutrition. And once you've done that long enough and have those habits locked in, the medications become far less important. That's our method. Those are the 4 pillars for weight loss: underlying conditions, nutrition, exercise, and medications. But all of this isn't just about losing weight. It's a very small part of our whole method, the Take It Back method. This is about reclaiming your confidence, reclaiming your energy, reclaiming the version of you that you know is still in there, even if they've been buried under years of exhaustion, frustration, and false starts. Let me say this very clearly. You are not broken. You've just never been given the full plan. That's what the Take It Back method is all about. It's not just a health plan, it's a revolution, a personal uprising, a refusal to settle for feeling old or slow or heavy or broken. So if you're tired of all the noise, if you're done with one size fits all advice, if you're ready to finally feel like yourself again, then stay with us. We've got episodes coming up that will walk you through every step. The muscle, the mindset, the hormones, the strategy, the real work with real answers. Because here we don't chase trends, we take it back. Your energy, your drive, your body, and your life. And we're just getting started.